Not everyone in the United States has equal access to quality healthcare. Certain groups of people, specifically those of racial minority, low socioeconomic status, poor health, and rural geographical location, have more difficulty accessing quality healthcare. These risk factors can converge to increase barriers. Individuals who belong to one of these groups are likely to also belong to another one of these groups. The vulnerability framework shows that these disparities work together in creating disadvantages for these group members, and experiencing more than one of these traits can multiply vulnerability. Hispanics and African Americans are more likely than whites to hold lower levels of education and have lower incomes. Hispanics also may experience a language barrier if they are from Mexico, Central, or South America. All of these risk factors converge to increase vulnerability and decrease access to quality health care. These two ethnic minority groups are also more likely than whites to lack health insurance. Individuals who lack insurance are less likely to utilize healthcare services. Because those who are likely to lack insurance are also likely to experience other risk factors, the barrier to care is further increased. Children are not exempt from these risks. 20% of children in the U.S. have a special medical condition. On top of this, obesity is a serious concern, and children tend to be more overweight in Hispanic and African American households, where insurance coverage and financial security is less likely, making access to health care a challenge. Another special population is women. Women tend to have poor health and higher morbidity than men. More women have chronic health conditions, ongoing need for treatment, obesity, heart disease, poor mental health, and stroke than men. Some of these concerns are higher in minority groups. Yet again, we see risk factors converging and vulnerability rising. People living in rural areas are likely to have lower incomes, poor transportation, and a lack of nearby medical facilities. They are also less likely to utilize health services and are in poorer health. In addition, healthcare professionals do not want to live or work in these areas. Perhaps these populations would be able to access care if it were more readily available. Mental illness is a major concern and contributes to other health problems such as heart disease and cancer. The NIMH has discovered that 1 out of 5 adults experiences a mental health disorder, and 62% do not seek treatment. This also includes low-income individuals, women, and young people under the age of 25. The lack of treatment can be partially attributed to the high cost of quality mental health care and the low number of available healthcare professionals. In addition, it can be difficult for the uninsured to access and afford this kind of care, leaving those with other risk factors, once again, more vulnerable. Chronic illness and disability can make it challenging for people to function in daily life, and thus it is a greater challenge to access necessary health care for those issues. Those with chronic illness and disability are less likely to be able to work, thus placing them in another risk category of a lower income. The number of HIV and AIDS cases is fortunately currently on the decrease, and this disease is especially prominent among African Americans and Hispanics. In addition, many individuals with HIV or AIDS live in rural areas and are not able to access the necessary health care. One goal of the healthcare system is to provide equal access to all, which does not mean a one-size-fits-all approach, nor does it mean focusing on one risk factor at a time. Effective solutions to unequal access will consider all risk factors that converge to create vulnerability. One such framework was created by Penchansky and Thomas in 1981, which discusses the 5 dimensions of access that need to be addressed when changes to policy and programs are made to target vulnerable populations: availability, accessibility, accommodation, affordability, and acceptability. Availability refers to just that, whether services are available to patients. This could include transportation available to get to appointments, translators for patients with language barriers, and proper primary and specialist service for specific health concerns. The next dimension, accessibility, refers to location. This could include transportation to medical services, but it also includes nearby location, convenience for disabled patients, and acceptability of different types of insurance and payment methods that patients may need to use. The third dimension, accommodation, refers to the ability for the patient to actually utilize the healthcare services. A patient should be able to reasonably schedule an appointment during normal hours of the day within a reasonable amount of time to be seen for their specific health concern. Affordability refers to whether an individual is able to pay for the healthcare services. This would include reasonable copayment and reasonable drug prices. This particular issue is a common concern for both the uninsured and the insured. Lastly, acceptability refers to the relationship between patients and healthcare providers. This includes providers' opinions of and attitudes towards their patients and their concerns and beliefs, as well as their level of understanding after leaving their appointment. Changes in healthcare delivery are ongoing. Penchansky and Thomas's framework is only one example of the factors that need to be considered in addressing unequal access. Targeting one or two risk factors will not be effective enough in helping to give all populations better access to care, as it does not address all of the possible reasons for access being unequal. Unequal access to care is a serious concern. However, ongoing changes are in play, such as increases in coverage under the ACA, new medical schools emerging in rural areas, and further development to government programs. These are just some of the examples of the multifaceted changes that we need in order to eliminate barriers to care.